AMBAR is the result of 2 decades of investigation promoted by Grifols in the way of treating Alzheimer's disease through plasma exchange. The first trial was conducted in 2005, which was a pilot trial. Then a second trial was conducted in 2007. It was a phase 2 trial, and this AMBAR result was started in 2011, and the results were published very recently in Alzheimer's and Dementia. The schedule of the trial was first therapeutic plasma exchange once a week during 6 weeks, followed by low volume plasma exchange once a month during 12 months. So doing this way, we remove the albumin-bound peptide, and we replace with albumin free of A-beta. And the primary outcomes were the ADAS-Cog scale, which has to do with general cognition, and the Alzheimer's disease cooperative scale, activities of daily living scale, which has to do with basic and instrumental activities of daily living. So those were the 2 primary outcome measures. And we also utilized several secondary outcome measures. The most relevant from the clinical point of view were the CDR and the clinical global impression of change, which will be presented at the meeting. What we saw in the primary measurements was less deterioration in people who received the plasma exchange, in the people who received the treatment, with an effect size of 60%. That means that if normal, non-treated people deterioration, for instance, 100 points after 14 months of treatment, in this group of sham treatment, the treated people who were treated with plasma exchange did not deteriorate 100, but deteriorated 40. So that's a 60% less deterioration in cognition. And that was not statistically significant for the whole sample, but it was for the moderate dementia subgroup of patients. Those were the primary results of the trial. The reason we believe that was not significant for the mild dementia patients was that probably the ADAS-Cog and the scale of activities of daily living were not sufficiently sensitive for the initial stages of disease. And in fact, the secondary outcome measures, which were the CDR and the clinical global impressions of change, were not only statistically significant for the whole sample of patients, but indeed were even the benefits were even higher for the patients with mild dementia respect to with patients with moderate dementia. So what we think is that in fact the treatment is having more effect the earlier you provide the plasma exchange to those patients. Next steps will be probably to define. We are still trying to figure out how it should be the next steps, but since we conducted this trial with the all 1982 criteria from the National Institutes of Communicative Disorders and Stroke, which were criteria from 82 by Mike Kahn and colleagues, our patients were not completely defined in terms of biomarkers. So the next step should be to better define these patients and try to identify which are those patients who respond even better to the treatment, to direct the treatment to those people.